Hi, I'm Mark Zemmel, CEO of Retia Medical. Retia develops advanced algorithms that help clinicians protect vital organ function for their high-risk patients. Today, I'll be talking to you about the Argos hemodynamic monitor and our commercial progress, our new product, Argos Infinity, and our exciting pipeline of AI algorithms. We participate in a $4 billion market for high-risk surgical and critically ill patients. The Argos monitor has FDA clearance, CE mark, and we're sold in 15 countries. Last year, we grew unit sales by 60%, and we grew our hospital install base to 60 hospitals. Our key advantage is our algorithm is 42% more accurate than the leading competitor. That's been shown in studies, head-to-head studies. This year, we just announced 3 weeks ago a partnership with Medtronic to sell our monitors across the US. Already in Q1, we've matched our unit sales from all of last year in partnership with Medtronic. In addition to supporting that launch, we'll be submitting a FDA application for our new software-only product, Argos Infinity, and including also development of our next-generation AI algorithms. Better technologies are needed to address the increasing shortage of care providers and the increasing admission of hospitals of older and sicker patients. The alternative approaches in this space are mainly risk scores that don't provide the fidelity you need because they're based on intermittent data. So you're not able to really detect rapid patient deterioration. They don't provide guidance to diagnosis and therapy, and they're not specific enough for you to really personalize the care for these high-risk patients. So Retia's approach is we're combining AI with physiology-based models using continuous real-time data. And that gives you faster responsiveness to changes in patient condition. It gives you what we're calling a digital physiologic twin, right? And that gives you the ability to now guide diagnosis and titrate therapy. And ultimately, we'll be deploying clinical decision guidance tools based on AI that will allow us to really personalize the care of these high-risk patients. And that proactive personalized care is important because that's how we're going to prevent the costly complications. We're talking in the US, 15 million patients who are getting these high-risk procedures or stays in the ICU, and they're at high risk of cardiac injury, acute kidney injury, and other complications. They're terrible outcomes for these patients and very expensive to the healthcare system. One of the primary sources of these complications is that 70% of these patients experience circulatory shock. And when it happens, the longer that patient is in shock, the higher the risk of the complication. So today, most clinicians detect that shock from the hypotension alarm on the bedside monitor. Problem with that is it doesn't detect. A lot of patients have what we call hidden shock before the blood pressure drops. Hemodynamic monitors can detect that, but they're not frequently used today. Retia's goal is to make hemodynamic data ubiquitous for all these high-risk patients. So in this $4 billion market, we're focusing on the 20 million patients who every year get an arterial line for beat-to-beat blood pressure monitoring for circulatory shock. And of those, so that's a $2 billion opportunity. Of those today, only 2.5 million get hemodynamic monitoring, and that's an $800 million today sales, mostly dominated by BD, which they have a good monitor, but it doesn't work on all patients. And that's the challenge that we sought to overcome. Our thesis when I started the company was that we wanted to make a monitor and an algorithm that was consistently accurate, streamline the setup and use, reducing that friction to get data in the hands of clinicians, right? Also by making it affordable so you can use on every single patient. And just 2 years ago, that thesis was validated by a survey of over 600 doctors. So Retia's Argos hemodynamic algorithms, right, have proven superior accuracy that have earned clinical trust. We provide 10 parameters that help clinicians detect shock and titrate their therapy. The multi-beat analysis algorithm that was developed by a world expert in biosignal processing has been proven to be 42% more accurate than the leading competitor. It's the only algorithm that's accurate in cardiogenic shock and in patients with arrhythmia. We're talking 50% of people above the age of 70 have some form of arrhythmia. It also detects hidden shock. So at Johns Hopkins, they did a study of 10,000 patients, and it showed that increased exposure to hidden shock led to increased rates of acute kidney injury, cardiac injury, and mortality, right? So it's very important to improve that care. This technology is patented, protected by 11 patents that we licensed from Michigan State and MIT. So we have a growing network of hospitals using the Argos, 60 in all. What I'm most proud about this, you see all those asterisks, those are folks that are repeat buyers, and they keep buying because we expand organically through the hospital. We're used cardiac OR, general OR, and all different ICUs, wherever an A-line is found. I mentioned our repeat buyer is a big portion of our install base. Our monitors used in some cases every day in the OR, and our net promoter score is 83, which is much better than typical med tech, which is in the teens. Here's an example of why and how we've earned clinical trust. There's a doctor in Belgium, and he wanted to try weaning his patient off of vasopressors. So vasopressors are used when fluids are not supporting the patient's blood pressure. They cause the vessels to squeeze, increasing their vascular resistance. We would say SVR, or the index value SVI or RI. And so you see in blue, right, they turn the vasopressor off, and correctly, Argos showed a decrease in the vascular resistance, and then when they turned it back on, it went back up. And you can see what the competitor did. It was completely confused, right? Cardiac patients, sepsis patients, a lot of patients on ventilators, they're all on vasopressors, and if you can't get off pressor, then you can't get out of the ICU. So it's very important for bed turnover, which is revenue for the hospital, and extended exposure to vasopressors, that raises your risk of acute kidney injury. So once they trust the accuracy, they fall in love with the monitor. And we see here a nurse, he's hugging it, right? Because it's empowering that nurse to provide better care, right? And improving the clinical communication, right, for that care team. And here's a doctor at Cleveland Clinic. He said, this monitor is most closely aligned to the medical reality and helps raise the floor for the standard of care. But we're not done. We have an exciting pipeline of software and AI algorithms that are continuing to push the state of the art in critical care. So Argos Infinity, which is an AI cardiorespiratory platform, it's software only. This is a $115 million annual recurring revenue opportunity. Converts us from a capital box sale to a software subscription sale. And last week, I'm pleased to say, we deployed this at Cleveland Clinic across multiple campuses, multiple ICU departments, and they can even VPN from home and look on it on their smartphone. I actually have access on my phone as well, which is really cool. So this brings us one step closer to that digital twin that I was talking about, because we're going to continue to deploy additional algorithms on the same platform. No new hardware. So it makes it very easy to integrate into the hospital's IT. So we'll be submitting for our software as a medical device at the end of Q2. And this algorithm then can be deployed on our platform or other platforms, as many people are building their all-digital ecosystems. One of the exciting new algorithms that we're developing is a non-invasive version of our multi-beat analysis algorithm. It's a $200 million opportunity for L&D, emergency room, heart failure, and the way we win, right? Again, no new hardware, available at every bed via Argos Infinity, and it's leveraging the outstanding performance of the existing algorithm, superior to competing hemodynamic monitoring technologies. We have AI-assisted diagnostics to help detect shock. Think of this as like lane deviation assist on your car. We're helping you avoid that crash before you get there. So we got on the market 6 years ago. We did kind of a soft launch. We're building relationships with key opinion leaders and reference accounts. We did a full launch after our Series B, led by Fresenius, in 2022. We came out of the gate with 1.2 million in revenue. Last year, we grew revenue by 50%, and now we're launching with Medtronic. And that partnership with Medtronic is going to really accelerate our sales ramp, as you would expect, pushing towards profitability by 2026. I have an experienced team of leaders with prior exits in this space and an outstanding world-class clinicians, both anesthesiologists and intensivists, who are advising us. The AI digital twin that we're building with this platform, that's going to increase care efficiencies and deliver the parameter bundle that strategics need to both provide the right platform for critical care and implement that clinical decision support that we all want to do to improve the state of the art in critical care management. If you want to join us on this journey, I invite you to talk to me afterwards, and thank you for your attention.